Okay, ladies and gentlemen, now we are approaching the conclusion of the 2026 of the Asia Pacific Health Promotion and Non-Communicable Disease Prevention Workshop. Now we are going to welcome Dr. Day2, the Vice President of the Finance and the Taiwan Regional Director of APAC, to give us the closing remark. Let's welcome Day2.
I don't want to stand between you and lunch, so this is going to be brief. All right, distinguished guests, respected speakers, and dear colleagues and all participants. As we draw the second day of the Asia Pacific Health Promotion and the NCD Prevention Workshop to a close, it's my great honor to express our deepest appreciation to everyone. The theme of today's session, Advancing Digital Health for Physical Activity and Nutrition, Policy Translation and Governance, aptly guided our discourse toward integrating innovation, policy, and international collaboration across the Asia-Pacific region. The presentations and discussions were both insightful and forward-looking. We began with an eye-opening presentation by Dr. Yuhong Zhang, because we all know that no measurement, no management. No measurement, no management. So he introduced a logic model-based evaluability assessment tool, which can help strengthen the planning, implementation, and evaluation of public health programs. Director Audrey Tong, our superstar today, demonstrated how Singapore's comprehensive sodium reduction strategy combines policy, industry partnerships, digital platforms, and the public engagement to create a healthier food environment. And also, I really must say I am so amazed by her talk yesterday and today, because I feel that Singapore government is very brave, very strong to shift the market, align the supply chain, and also very good at slogans. Less salt for more taste movement. In Taiwan, we call it brainwash. 洗脑. Very successful slogan, okay, to make people believe less salt even has better taste. Very successful. Director Takehiro Sugiyama mentioned ICT and PHR tools are positioned within the national specific health guidance framework, and also highlighted that for keeping or becoming healthy, participants' aptitude, including motivation, ICT literacy, and personality matters more than age. And Japan has always been a leading country in Asia for a long time, including life expectancy. So we know that you must have done something very right all the time. And Dr. Junbo Lee introduced Korea's Digital Medical Product Act. I believe this is the very first one in Asia. We don't have this kind of act in Taiwan yet, okay, which came into effect in 2025. Such dedicated legislation for digital medical products remains relatively uncommon internationally, making Korea an important example or role model of how regulatory systems can evolve alongside rapidly advancing digital health technologies. And from his roundtable discussion, I would love to say that I envy the Korean government as well, because they were answered to improve the trust of AI, or people's trust on AI, is that, because KFDA will approve it. And this reminds us, actually, people doesn't trust on AI tool, but they trust on Korean government. A especially KFDA. And I have to tell you a little secret. Because Taiwan FDA is more conservative. They almost never pass any new thing unless US FDA approve it first, or European FDA approve it first. They don't want to be the first. Okay. And Dr. Dong Su Zhang reminded us that successful AI-supported nutrition care depends not only on technological accuracy, but also on effective human-AI collaboration. Human in the loop. Human always in the center of the loop. Appropriate governance and workforce capacity building are always very critical. And workforce capacity building is the key word and the main purpose of our workshop today and yesterday. So our roundtable discussion followed further reinforced an important message. Only by working together can we ensure that innovation remains safe, evidence-based, equitable, and centered on people's needs. So as we close this workshop, I hope you all leave feeling empowered by the rich exchange of knowledge and inspired to carry forward our collective mission of promoting health and preventing disease across the Asia-Pacific region and all over the world. On behalf of the organizers, I wish to express sincere gratitude to each of you, participants, speakers, moderators, and our handsome MC for making this event a success. And once again, we look forward to seeing many of you again at the 57th APAC Annual Conference in Tainan this October. Don't miss our parallel session, Advancing Health Promotion, Digital Innovation for Physical Activity and Nutritional Management. We have invited more very excellent Asian speakers who join us in October. Until then, may you all remain healthy and safe. Thank you, and see you next time.
Thank you so much, Dr. Haley. Wonderful closing remark.